All right, so today we're going to be talking about contraceptive methods or birth control, as you've probably heard it. There's a lot of different kinds that we're going to be talking about, so we'll get right into it. Um, well, first of all, you need to understand that um, abstinence, you're going to hear me say this a lot. Abstinence is the 100% way to avoid getting an STD as well as getting pregnant. So keep that in mind. Abstinence is, we should have learned that already. Just, in this case, it's avoiding sexual activity. Obviously, if you're avoiding that, if you're staying away from it, then you're not going to risk getting pregnant or getting an STD. And then other methods, we're going to talk about barrier. We'll get into these in detail, but barrier methods, hormonal methods, intrauterine, natural family planning, sterilization, emergency contraception. So we're going to talk about all of that throughout this lecture. Like I said, abstinence, the only 100% sure way to avoid getting pregnant or STDs. Please understand that it's more, usually when people think about like sex, they think vaginal, but it's more than just that. So make sure that you understand that there's all different kinds of sex that will put you at risk. So yeah, 100%. It's the only time you're going to see that. Okay, moving on to barrier methods. So I'm sure most of you have heard of condom. I want to point this out. It'll make sense in a little bit because we're going to go into the next slide, which will show you that there is an internal condom. So hang tight because some of you might be confused, but we'll get into that. So condoms usually are latex. For those that are maybe allergic to latex, there are other types of condoms, but this is the most used, the most popular as far as condoms go. I think it's funny that this has to be put on here, single use. I don't know why people would think to maybe reuse. I don't know. Let me just say, if you try to reuse, then it's not going to be effective. Now, I want to point this out. When used correctly and consistently, they can actually be really effective. So one thing you're going to see with these percentages is anything that is reliant on the user to like do something correctly, it's going to be not as effective. Like you're going to see these lower numbers. So if it's like the condom where you have to use it consistently and correctly, then that allows for error, obviously, because people may, I'll just tell you some of the things that people may do with condoms would be like, this is kind of funny, but using two, thinking that they need to use two for extra protection, actually that, like using two or that method would cause friction and actually could break, have the condoms break. Another thing would be a common place for people to store the condoms. It may cause the friction, if you put it in a wallet or a purse or whatever, or different temperatures, then it could damage the condom and prevent it to tear, or sorry, cause it to tear, not prevent. So just keep that in mind. Like, read the box. Like, I'm not gonna post a video. We're not allowed to show you how to do any of this, to put it in or whatever, to put it on with these methods. So read the box. There's instructions. There's important information on how to use correctly. So make sure that you are doing that. So keep this in mind. This is what you'll have to write in your notes. Okay, so the internal condom is actually something that can be placed in the vagina. I'm going to show you a chart later on that shows the percentages of like preferred methods, and this is not super high up there, but it is a barrier method, so it blocks the sperm from entering the uterus. That's something that you guys need to know. You're going to be quizzed on this. This very thing, that the barrier methods, basically barrier, if you think of what a barrier does, it blocks something, right? So barrier methods are going to block the sperm from entering the uterus. So you can see here's the vagina right here. Here's where the cervix would be, the uterus, the fallopian tubes, okay? So the female, the internal condom is just going to block the sperm from entering. So that's so then, like I mentioned before, effective rate because user error. But yeah, if used correctly, consistently, then it can definitely help to prevent and be pretty effective, as you can see. So we have the internal and external condoms as barrier methods. Just make sure that I've covered everything. You read the instructions. One thing I'll probably mention a few times is like, there's not like I suggest you use this one. This is where, like, I'm not a doctor. This is where you need to go and consult with a doctor about what method is best for you. So as you read through or listen to this lecture, and maybe you are sexually active and you're not on any kind of birth control, I highly suggest you change that. Okay, another one is the diaphragm. Remember, we're still on barrier methods. So this is a soft silicone cup, and it's inserted in the vagina before sex. I want to point out the 88, the low end, because it's, user error, it could happen. Covers the cervix, which is going to act as the barrier, preventing the sperm from going up into the uterus to find the egg in the fallopian tube. This is not a one-size-fits-all, so like I mentioned before, go and talk to a doctor if this is something that you're interested in as far as a method. Spermicide contains chemicals. This is another barrier method. It has to be inserted into the vagina before sexual activity. And if you notice from this, a lot of people will use spermicide with the diaphragm. A lot of different forms can be purchased at the drugstore, convenience store. May cause irritation though. So one thing you need to understand is 0% from STDs. And this was kind of interesting. It may raise the risk of HIV, and it's because of this chemical that can disrupt the wall of the vagina. So kind of interesting there. So spermicide. Okay, so those are barrier methods. You got to remember, barrier is just going to block the sperm from entering the cervix and going up the uterus to the fallopian tube. Hormonal methods, this is one that you've probably heard most of. One thing I want to point out, you're going to start to see on STD protection is going to be 0. If you think about STD protection, barrier methods, what those consist of or what those entail, those are going to be more effective against preventing STDs along with pregnancy, but hormonal methods you're going to see don't. So I want to point this out. 91 is the low end because since this is like it's like regulating hormones and regulating your menstrual cycle, you have to take the pill the same time every day. So with user error, if you're forgetting, oh shoot, I forgot to take it this morning, like if you always take it in the morning, then that could cause some issues for you. So, okay, so one thing with hormonal methods is basically what it does is it's going to keep the ovaries from releasing the egg, because remember, ovulation, once a month, the female releases a mature egg. Okay, so it's not only going to stop that, but it's going to thicken the cervical mucus. So this makes it really difficult for sperm to continue. If they've got to try and fight through and swim through thick mucus, a lot of them will just die off or give up and die. So hormonal methods are going to prevent ovulation, okay, prevent the egg from being released, as well as thicken cervical mucus. Like I mentioned, take the pill the same time every day. It contains a lot of different synthetic, which is man-made, hormones. So that's what the pill does, the birth control pill. It does not prevent against STDs. I think that's it. Oh, just understand that anytime you're messing with like hormones, there's going to be side effects. Different side effects. Here's a bunch right here. You're going to start to see the same kind of things or others as we go through the different hormonal methods. Some of you may have been prescribed a birth control pill with not even being sexually active, and that's because it helps to treat acne. Sometimes a doctor will put people or a girl on a birth control pill because it helps to regulate the hormones, which can help to reduce or help at least with acne. So that's an interesting fact there. Okay, the patch. So now that you kind of know like what hormonal methods do, I'm kind of going to go a little bit faster through these slides and just help you to see the difference in the method instead of like telling you what it does, because you should already know what it does. It's going to block the release of the ovary, or sorry, the ovum, the egg, and then it's going to thicken the cervical mucus. So just know that about hormonal methods. So this is just a thin plastic patch. You can see where it's placed on the body, releases the hormones. You're going to apply it, a new patch once a week for 3 weeks, and then the 4th week is patch free, which is going to allow for menstruation for the period. 0% here, 91 to 99% there. And then you might have heard of the shot, Depo-Provera. It's an injection of progestin, which is the synthetic progesterone given in the arm or the butt. Same thing right here. And then you get a shot for 3 months. It'll last for 3 months, and then you get it every 12 weeks, which is kind of, it's the same thing there. 0% from STD, and then 94 to 99% for pregnancy. I'll just say it again, this is something that you need to talk with the doctor about, what they suggest, maybe what you prefer, or something that you're wanting or leaning towards. Like for this, like some people that are like, I'm not going to be able to remember to take a pill every day. This might work, where you just have to, every few months, go get a shot. So it just depends on you, the type of person you are. Let's see. Okay. Vaginal rings. So it's about 2 inches. It's inserted into the vagina, continually releases hormones for 3 weeks. It's kind of like the patch as far as timing. You remove it for the 4th week, and then that allows for the period. You can see some side effects. Consult with the doctor about that. Implantable rods. This is, it literally, like, you can see where it's placed. It goes just underneath the skin, and then it's going to do the same thing that all the other hormonal methods do. So it's super small. This is one where you can have it in for 3 or 4 years. So if you're one that's like, yep, definitely can't remember to take a pill, definitely don't want to have to go get a shot once every 3 months, then this might be an option for you. Point this out right here. So I'll just remind you what hormonal methods do. They stop ovulation, stop the egg from being released, and then they also thicken the cervical mucus so that sperm have a difficult time continuing on in their journey. There's some side effects there, because anytime you mess with hormones, you're going to have side effects. Okay, IUD, intrauterine device, is what that stands for. So the copper IUD, the interesting thing about this is it's not hormonal at all. It's actually, the copper kind of acts as a spermicide. And so it's a little T-shaped device that is placed in the uterus. It has to be placed by a doctor. And then it acts as an inflammatory reaction to prevent the sperm from reaching the egg. So this is interesting. It can last up to 12 years. I don't know how many people keep it in for 12, but again, that's something you would talk to your doctor about. So it's not hormonal at all. It's basically just a device that copper acts as the spermicide. I mean, there's probably, I would assume everyone understands that there would be discomfort if a doctor has to go up. Think about it. The doctor has to go up the vagina in the cervix, which is a very small opening, into the uterus to place the device. It doesn't start looking like this. It starts as like just a little rod, and then they can pull the string that will, once in the uterus, get it to look like the T shape. Okay, and then there's a hormonal one. So remember, the copper one is not hormonal at all. It's just the copper acts as the spermicide. Hormonal goes back to what really, like we talked about with hormone methods. So it's the same kind of thing as far as the doctor placing it in your uterus. and then, but it's going to regulate hormones. It's going to continue to release progesterone. It's going to thicken the cervical mucus, and then prevent the ovulation from happening. This is about 3 to 7 years. Again, you would just talk to your doctor, see what they recommend. Natural family planning. This one basically is like you keep track of your cycle, you keep track of when you're ovulating, and then you can either prevent by not having intercourse, or if you're trying to get pregnant, you can know when to have intercourse. So that's basically what natural family planning is you're really using any other method aside from keeping track of your menstrual cycle. There are so many apps for that. And hopefully you know your body best, so you would be able to know like if your cycle is regular, because it's important to be able to know when you're ovulating, because that's when the egg is present. Okay, and then withdrawal, most of you probably heard of this. Let me just point this out right here. First of all, 0, and then this is variable because honestly, like, it takes a lot of self-control for the male to be able to do this. Also, not always effective because they're in the pre-ejaculate, there is sperm, so that can increase the risk there. So just know that this is pretty low on the effective scale, so be very careful if this is the method that you decide to go with. Sterilization, basically the male can get the vas deferens, which is why it's called a vasectomy. Right here, they cut that. They block the sperm from continuing on. So I don't know if I can't remember if I talked about this in the male anatomy lecture, but some students ask, well, where does the sperm go? So I want you to understand that males still produce semen, so they still ejaculate, but there's no sperm in the semen with a vasectomy. The sperm just kind of absorb into the male body and die. So it's kind of interesting there. I have heard that there is such thing as reversal. If you're like, oh crap, I don't want the vasectomy, I want to actually have kids, but I don't know how often that happens and how effective that is at being able to have kids. So that's for the male. For the female, you probably heard getting tubes tied. This is a good visualization. So yeah, it's just basically going to close or block the fallopian tube so the egg can't really travel there. Okay, emergency contraception. I need you guys to understand something about this. This is, so a lot of people will take this pill, well, if unwanted sexual intercourse or sexual assault, or if they're like, oh crap, I made a mistake, I don't want to get pregnant. But just understand that if you have already ovulated, then this isn't going to do anything. Emergency contraception basically just prevents ovulation. So it's kind of like the hormonal methods, where if you haven't ovulated and you take this, then it's going to work. It's going to do its job. You're not going to ovulate. But if you've already ovulated, then there's a chance that you'll get pregnant. So just understand it's not going to terminate the existing pregnancy. So yeah, you might still get pregnant if you've already ovulated, which is why this is so low down here. There's some side effects there. Yeah, so like I said before, you guys, abstinence is the only 100% way to prevent pregnancy and STDs. If you are sexually active, you need to make sure that you're being smart about it. I'll argue about this with you all day. 15, 16, 17-year-olds, you are not ready for a child. And I'm talking like physically, mentally, emotionally, financially. Go and talk to a doctor and see what method works best for you, if that is the route that you need to go to make sure that you're preventing pregnancy and STDs. I'll just leave you with this, with different methods, the commonly used methods. I know that this is pretty old, but through further research, I've kind of found that it's pretty much the same. That these are the top 5. Withdrawal would be 6. A lot of people prefer the pill. Remember, this is tubal ligation or tubes tied, male condom, vasectomy. and then the IUD, and then it kind of goes on from there. So there you go. Okay, let me know if you have any questions. Hopefully you learned some stuff about contraceptives in this lecture.